Good morning. Myself Manjusini. We are discuss about the breast examinations and definition. A breast examination is a crucial procedure for detecting abnormalities, including breast cancer. Can be performed both as a self examinations and clinical examinations by a healthcare professionals. Then type of breast examination: self examination. This is the personal check performance by individual to identify any change of abnormalities in their breast. It is recommended that women perform self-examination monthly to detect the any unusual length and change early on. Clinical breast examination conducted by the healthcare providers and clinical breast examination involve a physical and visual inspections of the breast. This exam is typically part of routine health checkup, used especially for women aged 24 and old. Then recommended annually women age 40 and above. Then to perform a breast examinations, follow these steps. First, visual inspections. Stand in front of minerals and inspection your breast for any change in size, shape, color, check for swelling, distortions, dimpling of the skin. Manual examination: use of the pad of three middle fingers of fill and lump thinking and hardening knot in the breast tissues. Press down with light and medium from pressures. Breast quadrant: divided each breast into four quadrant: upper quadrant, inner quadrant, and outer quadrant. Then tail of the spans extending into the armpit. Check each area systematically. Menopausal women. Post menopausal women perform to self-examination on the same day each month, such as 1 to 15 days. To perform a breast examination, follow this step. Report change if you notice any change such as lump, skin irregularity. Report them to healthcare provider immediate. The next, regular basic is important for the early detection of breast change. For should be performed at least 1 month. Breast self-examination nursing responsibilities: educating the patient on the importance of BSE and how to perform the correctly, assessing the patient, identify normal breast change and recognize the abnormality finding, providing support, encouragement of patient during the self-examination process, monitoring the patient for any change in breast appearance of sensors of or reporting them to healthcare provider, ensuring patient understand the importance of regularly BSFE and need to be part any change and health professional. Nurses play a crucial role in the empowering patient to take the active role in their breast health and early detection of the cancers. Thank you.